best treatment for a melasma skin type? Now, melasma is a very hard condition to treat on the skin, and it normally presents itself with dark, big, large patches on the skin. Usually that's on the upper forehead, so if it's on the left side, it will be also on the right side. It's quite uniformed and quite clumpy in appearance. Now, the dark patches can also appear on the cheekbones and the upper lip. For female patients usually, obviously they are aware that they would have melasma. Now, treating melasma is very difficult, as I said. Now, you need to treat it in two different ways. Treating it at home with a tyrosinase inhibitor is a lightening agent. Now, lightening agents could be anything from gentle ingredients like kojic acid, arbutin, lactic acid. Now, these acids are great at not over-inflammatizing the skin. Now, your skin, if you're using prescribed medications such as hydroquinone, and a lot of the time the doctors will prescribe it with tretinoin, which is a form of vitamin A, it can oversensitize the skin. Now, what does that do to melasma? It can aggravate it. You really need to treat it slowly. Consistency is key, and also patience. Sometimes patients say, I haven't got time, I don't want downtime, I just need this removed. But sadly, with melasma, it can be quite deep underneath the skin, and we need to treat it layer by layer, as well as treating it at home with a good SPF. Your SPF needs to be a UVB and a UVA protector, so we call this a physical sunscreen. Those sunscreens that you get from the department stores are just chemicals, and not to mention those ingredients will go in and aggravate melasma even further, which will then cause more post-inflammatory hyperpigmentation. When patients come for their consultations here at Skin Perfection, they say, I'm always wearing SPF, I'm trying all different brightening creams, they're not working. Now, part of the problem is because, one, the ingredients are aggravating the melasma, and that's causing that melasma just to rise and constantly leak in the skin. The other issue is if you're using the chemical sunscreen, like I say, it's not protecting you from a broad spectrum. So that's your UVA, your UVB, and not to mention the blue light from our mobile phones. And if we're working on the laptops or in front of the computer all day, this is going to affect our skin. Understanding your trigger factors is also a vital component in treating your melasma skin type. Now, with certain trigger factors, we are looking at stress levels, how much sun exposure you're having, your hormones, and usually these are the three common culprits that really assess the level of pigmentation that's releasing in the skin. Going for treatments, please ensure your skin expert is checking your skin thoroughly. They should be putting your face under a skin observe or a form of skin analysis to understand where the pigmentation is, what type of pigmentation it is, whether it's sun damage or if it's the hormonal melasma pigmentation, how it got there in the first place. They should be asking you all these questions. Now, if you're unsure if you have melasma or not, drop your comments below and we will do our best to help you.